anniversary of the signing of the Americans with Disability Act, often referred to as the ADA. Let's celebrate this anniversary by remaining vigilant in our advocacy and for its full and effective implementation. Sorry. So the next session will be supporting youth with emotional disabilities, strategies for success. The presenter will be Dr. Shayla Polk, who is a licensed clinical social worker, and she also works in the office of Governor John Bell Edwards, one of my favorite colleagues. You can read the description for this session and her bio on pages 16 and 17 of the conference booklet, which will be located in the chat, linked in the chat, I'm sorry. And so Dr. Polk, whenever you're ready, the floor is yours.
Awesome. Thank you, KJ. I appreciate that short intro. So anyways, I'm going to jump right in. I'm really excited about today because I get to talk about a topic that is near and dear to my heart. And before I go any further, I want to say part of this presentation is due to the fact that I have worked with youth that have had emotional disabilities. And I've also worked in the school system for about 4 years. I worked in the school system pre-COVID and post-COVID. And the number of emotional disabilities that were diagnosed after COVID was alarming, like the number was very alarming. But besides that, I think that it's important that we look at emotional disabilities because a lot of times our focus tend to be on the ones that are most talked about, which fall in line with mental health. But under that same umbrella, when we are talking about mental health, we also have to talk about emotional health. And emotional disabilities are just as important as any other disability. And so I would like to shed some light on that, that would help not only parents and not only youth that have these disabilities, but also people and individuals that work with youth that have these disabilities. So I'm just going to go right in, and I hope that I'm able to get all this information in a timely manner and not talk too fast, because in true Louisiana fashion, I tend to talk really fast. So I'm just gonna go right on in and we can go to the first slide. And so the learning objectives for today include an understanding of the common conditions associated with emotional disabilities and their impact on academic and social emotional functioning in adolescents. I also want to identify evidence-based strategies for promoting academic and social emotional success in adolescents with emotional disabilities across various settings. And the ultimate goal is to learn practical strategies for promoting success across a continuum of care when it has to do with adolescents who have emotional disabilities. Next slide. So what is an emotional disability? Well, that is determined by individuals who might say, well, you know, it could be something that we see out, like such as behavior, what some might term acting out or erratic behavior, right? But sometimes an emotional disability can also be something that is inward. So it could be a fear, it can be anxiety, it can be another emotional based condition such as PTSD or depression, right? And so oftentimes when individuals do have emotional disabilities, they may be misdiagnosed. And so it's important to understand that it might not look the same from adolescent to adolescent. Another term you may hear is emotional disturbance. That is normally what you would hear in a school system when there is a student that has been identified with an emotional disability, or you might hear the term emotional disorder. They're all the same. Next slide. So when we're talking about emotional disabilities, it's also known that is a mental disorder or a psychiatric disorder, right? but it encompasses a wide range of disorders. So some of the most common disorders that we might see, we might say anxiety disorders, eating disorders, psychotic disorders, conduct disorders, bipolar disorder, obsessive compulsive disorder, depression. Those are some of the most common emotional disabilities. These disorders significantly impact an individual's daily life and their overall well-being. So it is very important to note that while some emotional disorders are listed on this screen, there are many others that exist in the field of mental health. And the field of mental health is continuously evolving. But because these are the most common, I will cover these on today. And if you have any questions about any other emotional disabilities disorder at the end of this presentation, I do have my email, and you can definitely send me an email. Next slide. And the first one I want to talk about is an anxiety disorder. So this category includes conditions like generalized anxiety disorder, panic disorder, social anxiety disorder, very specific phobias, agoraphobia, and people with anxiety disorders experience excessive worry, fear, and of course, anxiety. And that in itself can interfere with their daily functioning. Next slide. And then we have bipolar disorder, formerly known as manic depressive disorder. So bipolar disorder involves a period of extreme mood swings, and that can range from depressive episodes where the individual feels very low, very sad, very hopeless, to manic episodes where they feel more elated and they seem very happy and they're more hyperactive or more impulsive in their behavior. Next slide. And then conduct disorder, right? This is a persistent behavior problem. It's aggression, it's defiance towards authority figures and societal norms. These patterns are often emerged during childhood or early adolescence. So you may see these come about, in 3rd, 4th, 5th, 6th, 7th grade. Next slide. And eating disorders. A lot of times, we don't really talk about eating disorders as an emotional disability, but it is. And then eating disorder such as anorexia nervosa, bulimia, binge eating, all of these disorders have very severe disturbances in an individual, whether that be the eating behaviors, their look at themselves and their body image, or weight management, identifying as being much bigger than what they are. And so, doing things to make sure that they stay a certain weight or falling under a weight that is acceptable for, let's say, their developmental growth and things like that. Next slide. And then obsessive compulsive disorder. That's a very common term. That involves the intrusive thoughts, the distressing thoughts, the obsessions that lead to repetitive behaviors, mental rituals, that would be the compulsion part, to elevate the anxiety caused by the obsession. So they're so obsessed that they become compulsive, and then they're trying to alleviate that, but that only increases the anxiety when they continuously do the same thing over and over and over and over. Next slide. And depression, very common, also known as a major depressive disorder. Depression is characterized by persistent feelings of sadness, emptiness, a loss of interest in activities that were once enjoyable. And this too can lead to significant impairments in daily functioning. Next slide. And post-traumatic stress disorder. A lot of times when people think of post-traumatic stress disorder, they think of adults, but children too experience post-traumatic stress disorder. There can be many of things that can cause PTSD in children, whether that be hurricanes or flooding or the experiences that we had with COVID, or even just environmental factors, right? Trauma and different things like that can affect at all ages. And so when talking about youth, when they experience or witness traumatic events, it overwhelms their ability to cope. And that too leads to a range of emotions and behavioral symptoms that you might see in the home or you might see in the school. So these events like I stated before, it could be physical, they could be sexual in nature. There could be accidents, and like I mentioned, natural disasters, violence. Sometimes children live in neighborhoods where there is a lot of violence, so they see different things, or even the sudden loss of a loved one can trigger PTSD in a child. So it's important that we are aware, because a lot of times children can be misdiagnosed as having one disability, when the truth of the matter is that child has actually experienced a traumatic event, and therefore they have PTSD and not so much, let's say, mood dysregulation disorder or something like that. So it's just important to make sure that we understand all of that before we move forward. Next slide. So when talking about emotional disabilities, they're expressed in two different ways. We have externalizing behavior, which is when the child will direct the behavior outwardly and towards the environment or individuals in that environment. And then we have the internalizing behavior, which is directed inwardly towards oneself. And that is a little different. So when we're looking at external expressions of behavior, that is the kids that everyone calls the troublemakers, right? That's the kid that's never listening, and everyone's getting very frustrated with. But then we have these kids that can go unnoticed. And those are the ones that are experiencing that internal emotional disability. So they might be the ones that are staring off into space, and I'll get more into that in a minute, but they might be the ones that kind of fall under the radar. So it's important that we not only know the signs and symptoms for those that are externalizing the behavior, but also the ones that are internalizing the behavior. Next slide. So looking at externalizing behaviors, right? You will see displays of anger, physical aggression, arguing. The behavior, like I said, is being the troubled child, destroying of property, does not respond to corrections, does not comply with directives. And that can be frustrating for some individuals who work with these children. But if we understand the why, the how, then we can look at it differently and be able to best help that child. Next slide. And when we talk about internalizing behaviors, that is the child that might frequently complain of being sick or hurt. They don't participate in class. They don't have a social life. They might not socialize with their peers. They retreat into daydreams. It's kind of like they're staring off. They might be shy, sad, very, very low self-esteem, just to name a few. These are also the kids that may be dealing with depression or anxiety, which could also go along with other emotional disabilities. So again, it's important to recognize that the child might not just be not paying attention on purpose. There might actually be a cause behind the behavior. Next slide. So the reason why I went through those definitions is because by understanding and addressing these behaviors, we foster a healthier emotional development in our children and in our adolescents, which allow them to succeed. I also want to point out the fact that some things are shaped by society. Studies show that girls exhibit internalizing behaviors more frequently than boys. Cultural influences a significant role in shaping these gender differences. And one might say, why are we bringing gender into this? Well, I will say I really don't have a choice, because one thing I recognized when I worked in the school system is the majority of my caseload was boys, 99% of the time. But when you look at the research, there's a reason behind that, because we set certain expectations on girls and then certain expectations on boys, right? Girls should always be nice. They should always be cheerful. We shouldn't show that we're sad, but if we do, we're going to get that emotional support. Whereas when it comes to boys, they have more externalizing behaviors, but they're also taught, don't cry, suck it up, you're good, you're strong, be assertive. So if I'm being told to not cry, but in the inside I'm crying, it has to come out a certain way. So therefore, it's going to come out in a more externalizing way, which means you will see more aggression in a child that's being told that, hey, boys don't cry, right? So again, important to know the difference. So you'll see more anger expressed in boys. And sometimes a child might have both. They might experience both internalizing and externalizing behaviors. But the key thing is, if we know these things, again, we're able to best help them succeed. Next slide. So going a little further, the reason why I brought up, again, the differences in temperament between boys and girls, or the expressing of emotions, is because that helps us when we're going to talk about evidence-based strategies, right? That will allow us to provide a supportive and non-judgmental environment. And then we are able to encourage them to have open expressions regarding their emotions, whether they're boy, girl, or whatever they identify as. So recognizing that gender difference in behavior helps you to tailor the intervention for them effectively. Then we have to remember, understanding co-occurring behaviors will also help you in providing comprehensive support in your intervention. And so I'm very much evidence-based. I feel like that is the way to go when we're making sure that our youth are getting best practices, but it also promotes academic and social emotional success. And if we don't have any evidence to say that this works, why would we use it, right? And so it's important that we have something that we know works. And so moving forward, the rest of this presentation will talk about the different things that we do know that works and that we do know have been tried, and they are true in helping individuals with emotional disabilities across various settings to be successful. Next slide. The first part I want to talk about is team effort. Anything we do in working with adolescents should be a team effort. So effective strategies for collaborating with parents and caregivers, key. We must be understanding, we have to be empathetic, and we have to be patient. We would always want to put the parent or the caregiver in the expert role. We do not want to question how they parent. We do not want to question in a way that puts them on defense. We ask inviting questions. We want their input. We do not tell them what to do. We use a collaborative team approach. So we're asking parents, we're asking caregivers, we might even ask about their self-care, right? What are you doing at home to take care of yourself? Because we all know a lot of times parents and caregivers are so wrapped up in caring for others that they forget to care for themselves. That is actually very important to know when working with children that experience emotional disabilities. We need to know how their caregivers are caring for themselves. And then if the child is old enough, we want to make sure that the child is also put in the expert role. We want them to feel involved. We want them to feel seen, and we want them to know that their voice is being heard. And always ask solution-focused questions. Be very specific in your questioning so that you can identify answers. And again, we want them to be able to help us, create, let's say, a treatment plan or create a behavior plan. Next slide. Now, this one is specific to school systems. So some students who fall under a category of emotional disability may have a 504 or an IEP, right? So the IEP is the plan, our program developed to ensure that a child who has a disability is identified under the law and is attending either whatever school whether it's elementary or secondary education, that they are receiving their specialized instruction and their related services. We also have the 504 plan, which is developed to ensure that a child who has a disability identified under the law is attending, again, in their elementary or secondary institution, that they are receiving their accommodations that will ensure their academic success and their access to the learning environment. So in doing so, this would lead to teachers providing students with accommodations and modifications. So it is up to the school and the teachers to set up this system whereby that we're able to help the student. Again, it's important to know this because even the teachers and admin should be developing relationships. Again, when we're at the table and we're talking about accommodations and modifications, the child voice, if they're old enough, should be heard. The parent's voice should be heard. Communication is key, respect is key, and empathy and understanding is definitely key. So this helps us by, we benefit from it. Not only we benefit from it, but the student benefits from it, the school benefits from it. And some of those accommodations or modifications may look like extended time on assignment, just to name a couple, alternative forms of direction. Communicating with families often, again, is key. So make sure that there is communication between the educator, the family, the learning, the teachers, anyone who's working with that child. Make sure they know, like, this is the plan that is in place and this is what we're doing, because we want it to be the same across all settings. We'll get into that more later. Sometimes, we will put something in place and we see that it's not working. Well, before we change, that should be change whatever that accommodation is, or whatever that plan is, or that goal. There should be a meeting where everyone is involved, including the parents, and we have a conversation about how we should move forward. Again, I can't stress how much communication is key in this situation. All right, so another thing before I move to the next slide, I want to encourage everyone that works under school support to understand that every family's expectations may look different, and every family's views about their involvement might be different, right? So there might be some that are not involved, but there might be some that are very involved. Either way, it's still up to us to make sure that we're getting the communication out there. You might have to send the letter 5 times, but you've done your part and you've at least tried to have that conversation when things don't go exactly how we would love for them to go when it comes to communication. I also want to ensure that we're we have cultural competence and that we are not biased in our approaches, and that we have cultural humility. It will take you a long way. We also have to be mindful that different cultures and different families have different views, but in doing so, be very respectful of that. It is not up to us to question or suggest anything. We let them handle however they choose to handle that. We just have to sit back and understand everyone doesn't think like us, and every family doesn't operate like our family. So just keep that in mind. Next slide. And to our behavior support personnel, which would be school social workers, school psychologists, and sometimes school counselors. I was in this role, so this one's very important. And again, I want to stress how important it is to work with our educational teams and our parents to develop and implement the intervention strategy, which should be positive behavior supports. Create trust, build rapport. If a student or a family doesn't trust you, you will not get anywhere. The goal is trust. At least that should be your first goal, is to create trust. And then we begin to problem solve, right? So we utilize our problem solving skills. We want to explore their feelings, their expectations, and all of that good stuff. I will say from a behavior interventionist perspective, it is important for us to not only educate the parent, but you should also educate the administration as well as the teachers, because we all come from a different background when it comes to behavior. We learn things, we're steady learning and steady educating ourselves, but sometimes some of our teachers or admin have not learned those things, which is, it's okay, because there's always room for education. And I think that is important that we know that. We can't expect them to just know how to do it. So sometimes you have to actually model how it should be done. We should also be training our students to problem solve themselves, explore their feelings again, give alternative options, respond to social problems, identify consequences of each choice, choose a response and evaluate the choice. So giving them that feeling, a sense of control. So allowing them to pick the things that they might be interested in that will benefit them in the long run, so that we can reach our goals. So again, I'll get into that a little bit more later, but giving them choices, it is key. Let's see. Involve our families in the positive support. So sometimes parents don't know that, you know, having a, let's say, a behavior plan in the house is important, just as important as the one that we have in the school system. I actually grew up on a behavior plan and never knew it until I learned what a behavior plan was. I don't even know how my parents knew about that. But they had us on a system. Like we had choices, we had goals that we were working towards, and we had rewards. And it was on the refrigerator, color coded. I still don't understand where they got that from. But they had a whole plan in place. And then I learned, okay, this actually works. You know, we could see what we were working towards. And that's what I would say that all families and all teachers should have in their classrooms, whether the child has the emotional disability or not. We're working to improve the school climate, to enhance our students' well-being, their sense of belonging, their safety, and their support. And again, this is a personal one, but I think mindfulness training is very important across all spectrums. And I think that when we do that, self-educate ourselves on things that work for students or individuals or adolescents with emotional disabilities, we're not only being a service to them, but we're being a service to our community. Always use strength-based approaches as well. Help the student identify their strengths, and then use those strengths to link them to success. Again, so behavior support should always be working with their teachers, admin, and again, being mindful about cultural biases and things like that. Next slide. So this one's a call to school administration, teachers, and school support. Again, it goes back to the same thing. Building rapport and good communication is key. Never start off with a complaint. If you're in a meeting and you have a student that has the emotional disability, and let's just say he's been acting out externally, and now you have to hold a meeting, don't start off with a complaint. Never criticize the behavior. Just show that you have genuine interest and genuine care about that student. Maybe start off with a fun story or something good about them before you have to move into why we're actually meeting about that behavior. Also, provide information to parents. A lot of times parents don't know what's out there when it comes to access to different care, whether it be counseling, wraparound services, and things like that. Make sure that you have that on hand to be able to give to them during that meeting, and never ask for medication. That is not our place. That is a parent's place. Just leave that alone completely, and avoid stereotyping and avoid labels. It's important that we don't label our students and that we don't stereotype our students. We sometimes have no idea what these students have been through. There have been times I can take one look at a student and know that that's an emotional disability based on a traumatic event, but all I heard was the negative, the negative, the negative. If we change the way we think about the disability, then we can better help the child. So if all I'm thinking is a label or a stereotype regarding that behavior, I am forgetting to look at the emotional aspect of that disability and what those signs and symptoms look like. So once I look at the signs, the symptoms, and the behavior, then I can connect the dots on the best way to help meet that child's needs so that we might be able to get rid of those behaviors. Next slide. And teacher strategies, again, build relationship with students by staying calm and building rapport, understand how they view the world, be non-judgmental, build trust. Trust is key. I can't tell you how many times students will tell me, oh, I know that teacher doesn't like me. And then you sit and meet with them, and not knocking any teachers, but you sit and meet with them and you can pick up as to why the student would think that. They should never know if you feel a certain way about them. Quick example, I have a sister who is a school teacher. She teaches 3rd grade. And she came to me, well, she sent me a message one day, and she was kind of like, I guess, going through a stage where she's really frustrated with some things going on in the school system, not necessarily with her kid in her class, but they were picking up on it. Like within a span of 2 to 3 days, she got the cutest little letters from her 3rd graders that were saying, hey, Miss Polk, I hope you feel better. I know, and then some of them said, I know we're not really good kids, but we will try to be better for you. They were picking up on nonverbal cues of her frustration, even though those frustrations had nothing to do with them and they were automatically putting it on them. So she and I had to have a little talk, and you know, I had to teach her a few little strategies not to do that, where they wouldn't recognize that she was also going through some things herself that were outside of the school. Another thing is sometimes our kids that have these emotional disabilities, they need things from us. And so what I've had her implement in her classroom is they have check-ins. They have every morning or whenever her students come in, they have a quick check-in, really short journal entry. And how that started was she had one student in the classroom where she said, Shayla, I just don't know what to do anymore. It's every day, the behavior, every day, every day. I said, well, just check in and see how he's feeling, because sometimes when we check in and see how they're feeling, we can then guide the rest of the day based off that feeling, right? So I told her, but you don't want to single him out. So everyone needs to do the check-in. We'll make it real short. And I kid you not, the very next day she sends me a message, and she said, he said he was feeling anxious and that he needed a hug. This is 3rd grade, mind you. And she was like, I gave him a hug and I've not had any behavior problems today. And so just that one example in one day changed the way that she interacts with her students every morning. So this year, they now all have like little mini journals that they will be using to check in. And so again, we have to sometimes modify our whole class to help best meet the needs of one student. And I know y'all, sometimes teachers like, oh, where will we find the time to do that? I told her, give them 3 minutes. They had 3 minutes to check in. So sometimes you have to cram something in, but in those 3 minutes, she found out that that one student was experiencing anxiety and needed a hug to help calm him. So it's important that, you know, we pay attention and use these strategies in our classroom. Quickly, due to time, avoid lecturing and always use positive enforcement. Do not engage in power struggles. Again, give them choices within the perimeter, state the consequences, and always communicate with care. Next slide. I found this online and I thought it was nice, so I just kind of added it into the presentation, and it says teacher-based support. Again, it's pretty much what I just mentioned. I'm not going to go through it, but you can clearly read some of the strategies that can be used to help support the students in the classroom. So for instance, like creating checklists to highlight the tasks that they've completed. And of course, always reward. It's very important to reward all the positive behavior. Next slide. All right, parental strategies. So be consistent. Consistency is key when working with your children. Having consistent expectations, consistent rules, consistent consequences from all adults in a child's life can be very stabilizing. And although initially there may be some pushback, an increase in the challenging behavior, that's absolutely okay. That's very common. That will happen, but continue to be consistent. Also model calm behavior. It is difficult to keep your cool when your child is, say, having a tantrum or is being arguing back and forth with you, or even having a meltdown. But it's important for you to regain your composure so that you can help them calm down. And one way to do that is to be on their level, eye level. It's important that you make good eye contact when trying to de-escalate a situation. That goes for anyone that works with children. Seize teachable moments. So let's say maybe you're having to put your child in timeout, right, because of something that they've done, but also use that time to speak with them about why, how long it will be, what is the purpose, make sure they understand, and just teach. Again, education, model what the appropriate or proper behavior looks like. And, you know, prior to reinstating them from the timeout. So like you might put them in timeout for 2 minutes or 5 minutes or 10 minutes, who knows, or if they're older, they might, you know, you might take a certain privilege away, who knows, I don't know what most parents do, but make sure you have the conversation before and after about why this is being done, and be consistent. Again, key. Always close the distance when speaking with them if you can, especially if you see them calming down. We want them to feel connected. We want them to feel loved. We want them to know that you're listening. We want them to know that you hear them. And also, if you can, educate yourself on calming strategies and be able to do that with your child. Sometimes a mistake that parents make is trying to get them to talk while they're still very elevated and they can't talk to you. So we want them to calm down first before we move forward. And again, I put this in all caps, very important to take care of yourself, because it is crucial to preventing burnout and maintaining consistency. If you're burnt out, you cannot maintain consistency. So make sure that you're putting yourself first in certain situations as well, so that you're better able to help your child. Next slide. And this is my final slide. And I'm going to call this the 3 keys to success. It is promotion, prevention, and intervention, right? So speaking of promotion, right? With promotion, we're building rapport. We're building loving relationships. So even from infancy, that might be holding and singing to your infant. That might be getting down on the floor and playing with your infant. Preschoolers, you know, getting down to their level for interaction, making sure your teen, you know, you do things with your teen, build those relationships with them where they're more open to tell you what's going on in their lives and don't judge them for it. Demonstrating, again, problem-solving skills, comforting them when they're going through situations, discussing problem-solving skills with them when they're running into things at school. Let's see, education is key. So educating yourself, educating others. If you come across an article, a peer-reviewed journal, or some type of research that has helped you with working with a child, or as a parent help you with parenting, sharing that with other individuals is also very important, because that is the only way that we can ensure that our kids are emotionally well, is through education and support. Providing an emotionally supportive environment, helping each other, reminding each other that we are a community and we are all working together, whether that's a school community, neighborhood community, wherever that might look like. And using using project-based experience learning. So basically encouraging your kids to collaborate with you, encouraging your students to collaborate with you to either plan and solve the problem. Use the social emotional framework It's very, very good when working with kids. And always be aware that every child's temperament is different and every child's response will be different. And recognizing that your reactions and understanding of those different temperaments are very, very important to their success. Understanding that culture plays a role in how a family sees themselves and how every one of us is unique, no matter where we come from, whether we're rich, poor, or in between. Recognizing that, again, that does play a factor in how individuals think and perceive themselves. Being there for them, not only on the emotional level, but on a social level, and then discussing this with not only your children, but if you're in the school system, discussing these things with the families. And that would be promotion. So moving to prevention, the number one key is to assess emotional wellness effectively. So prevent missed opportunities, right? If you don't know something or you're not sure, education is key. Observations are key. And as a parent and as someone who works with children in any setting, assessments are key. Screening tools, important. Identify, document any difficulties, document any behaviors, document the progress, and document the success. We want to see how far they've come, right? And always remember, don't set unrealistic expectations. Know what to expect based on the concrete knowledge of that child's development and their disability, and use current evidence-based practices when working with them. And we also want to prevent a lack of communication. I've stressed communication a lot, so I won't get too much into that. But again, always keep the lines of communication very open all the time, including with the child that you're working with. And again, avoid escalation of situations. Make sure you develop action plans in case something does escalate so that you can quickly be able to know what's next. So if the child has escalated to this level and you don't have time to think it through, if you already have a plan in place, then you can look at that plan and say, oh, this is what I need to do, and then follow that plan to the T. And then the final, intervention. Familiarize yourself with intervention services, best practices, evidence-based research, whether it be through the mental health field, child welfare field, child and family studies. Education is key. Any job I've ever had, I made sure to educate myself on exactly what I was supposed to be doing through peer-reviewed journal articles and research, because you can't do something if you don't know exactly how to do it. So someone has to go before us and do the research, and then we take that research and use it in our systems. And the last thing I want to talk about is, again, fostering successful collaboration. Always have everyone involved as much as possible. Provide documented information to intervention services. Make sure that it's comprehensive so that we can see exactly what it is that the child needs, and be sure that all adults are involved and have all the information that they need, and have access to communication with not only you, but with anyone who works with that child. That means teachers, behavior interventionists, social workers. Sometimes kids see therapists outside of work, and they might not be able to give you a full look at what they're going over with that child, but they can tell you what they're working on, and you can also utilize that information to use as well when you're working with that child. And that in itself will give you some success when working with individuals with emotional disabilities. That concludes my presentation. I know I was talking really fast, but I wanted to make sure that I got through it all. And these are the references. And if anyone has any questions, you can go to the final slide. And on the final slide, it has my information, which is my office number and my email address. And thank you.
All right, awesome presentation, Dr. Polk.
Thank
I
you.
just want to take this time to express my appreciation for our interpreters. A round of applause to y'all because woo. I'm
Ooh,
gonna look and see if you have any questions in the question and answer box. Let's see. You have time to answer a couple of those.
yes, I see some of these questions.
Okay. Okay, so someone said it would be prudent to distinguish between emotions and diagnosable mental disorders. Actual comment. Should the student be included in the IEP or 504 meeting?
I believe so, absolutely. Their voices should be heard, absolutely. Especially if they're of age. So, you know, if they're really young, and they don't understand, that's different. But if you're working in middle school and high school, they should absolutely have a voice at the table. I mean, it is their IEP and it is their 504 and it is for them. So yes, absolutely. Expectations, can trauma be learned? As infants, my kids learned that uh-oh meant there was a problem. Even my dog knows this. Can we use this concept to mitigate, train bad behavior by training them to calm down, relax, or respond with some other behavior when trauma occurs? So I'm not really sure how can trauma be learned? No, trauma cannot be learned. Trauma is something that we experience. I see here it says, as infants, my kids learned that uh-oh meant there was a problem. So that's different than trauma being learned. So uh-oh, meaning that there's a problem, means we know that something's wrong. That would be like saying, you know, if we know that we're supposed to be at a certain place at a certain time and we get a little anxious, like, oh my God, we're gonna be late. I would kind of associate that with that. But no, trauma is something that we experience. It cannot be learned.
I see another question.
It is helpful to remember we all are people and we cannot make someone do what they do not. I think you meant what they do not want to do. Absolutely true. But if we do our part in doing what we're supposed to be doing as people who are helping individuals, and I'm in a helping field, so I always say this, I will not be able to help them all, but if I'm able to help one, that's absolutely okay. As long as I am doing my part and doing it to the best of my ability and using the evidence-based practice, absolutely. There are some situations that honestly have kind of gotten like so far out, but at the end of the day, I feel like sometimes we can prejudge and say, oh, there's all hope is lost, but I never feel like all hope is lost. They might not get it today, but they might get it 6 years from now. So, but again, when a child or an individual gets to be a certain age, they are able to make their own decisions. So, you know, we can give them the resources, but it's up to them to use the resources at a certain age. What do you recommend for a parent who can't find behavioral health providers because of the shortage? So that is a true concern. I think now that there are a lot more options than people actually know about. So for instance, when we are looking at behavioral health providers, are we looking at behavioral health providers that are taking insurance or not taking insurance or taking Medicaid, right? So the thing is to identify all the ones in your area or speak to someone who has a referral list. It just depends on who, let's say what area you're looking at. I know now there's a lot of people that do things via telehealth, which has opened up more options, but some people would prefer in person, but there is a huge wait list. I know that to be true when it comes to getting behavioral health providers on board with individuals that have emotional disorders. So I would just recommend, if you have to be on a list, to get on the list, but also like I stated earlier, educate yourself and maybe start to put some of those plans in place at home or at school. Let's see.
We have a lot of people just saying great the piece.
I see them coming.
presentation was and how much information was given.
Yes. How was
We even have Dr. Lawrence, who actually presented on yesterday, also singing your praises and how much great the information that you've given
Thank
was
you.
as well. So
Yes.
he's,
I see
Yes.
another question. How would you address students that are being punished for disability-based behaviors and the IEP team wants to change their placement to a facility instead of providing those behavior supports? So I mean, I have definitely experienced that many of times. At the end of the day, there are some battles that we win and there are some that we lose. And I would always bring the data. I say data. Data drives everything. So for me, I would just bring the data, the data on the behavior. There's been times where I've printed out everything from the DSM for that certain disability and went over that in that IEP team meeting when they're wanting to change placements. And again, that goes back to just doing everything that we can help. And sometimes at the end of the day, because it's an IEP team decision, we might be on the other side of not getting exactly what we feel as professionals for the student.
Yes, and for time's sake, if you can just comment your number for Ms. Brooks under the question and answer tab.
Okay.
And once again, thank you so much. Any other questions, concerns, or comments can be left in the question and answer chat, and we'll be sure that we go through. I'm sure if Dr. Polk has a little bit of time to go through and answer a couple of more, she may respond that way. If not, like I said, she's a colleague of ours, so we can always get your questions and concerns to her for her to answer whenever she has the time to. So thank you so much.
Yes,
We
thank
do
you. I
have
appreciate it.
Yes,
I
it
think,
was great. Great.
yeah, someone said an additional concern for placement is whether or not the behaviors can actually be addressed in the school-based setting. That is true too. Sometimes the behaviors are severe in nature and they have to be addressed outside of a school setting. That is something we do have to deal with at times. But at a certain point, the need of the child may need to be addressed in a different setting due to financial limitations or need. Absolutely, Dr. Lawrence. Absolutely. Yes.
Yes.
Thank you.
The next session on state health improvement plan will begin at 1 p.m. So if you want, you can grab lunch if you haven't done so already and just join us back here for 1 p.m.